George Kilpatrick, Inspiration for the Nation. We're at the brand new, soon to be open Syracuse Community Health with Keith Cuttler. He is the Chief Operating Officer here at Syracuse Community Health. We're giving tours, and so this is first of all, I am blown away about what we're seeing here today. What have we got going on today?
It is tremendous. It's just a sneak preview because yesterday it was an active construction zone. Tomorrow it'll be an active construction zone. We'll be wrapping everything up probably mid-September and looking to have patients in here at that time. But, you know, we needed to give the folks who come to Syracuse Community Health Center, who a lot of them are from the 3 poorest zip codes around. We've all heard about that in Syracuse. But that doesn't mean they don't deserve something beautiful, modern, state-of-the-art. And it's not just the building that says that, it's the equipment. You know, the radiology equipment we're putting in here is top-notch. The mammography machine costs us more than double what most mammographies do because you can't get a better machine. The breast care center up there with the mammography machine is going to be a spa. It's wonderful. Everybody deserves to be cared for in a place like this.
Yeah, and what's the total cost of this renovation?
About $23 million.
Yeah, and so what's impressing me today as we go through the tour is that you have a lot of the medical professionals from various practices around the community here as well. How important is that to have them see what's going on here?
It's really important. You know, the current building that we're in is difficult to operate in. It's really not attractive from the outside. And I think it has the tendency to really extend stereotypes and predispose feelings. And this just gives a totally different feel to what Syracuse Community Health is.
Yeah, one of the things that you were going to say.
No.
Yeah, what impresses me is the amount of light. We can get a little pan over there to see how impressive it is when you walk in here. The amount of light that's in this building that is coming through is really, really impressive. Talk to me about that design and why it was important to have this kind of light.
Oh, sure.
Yeah,
light has a healing effect. It really does. It makes us all feel better. We hear about the vitamin D and the sunlight, and we're not getting enough, and we really don't get enough in Syracuse. So you have to take advantage of it. But not just with the full windows here in front, but on the second floor, every hallway has 2 giant skylights. And it is so bright up there, even on a cloudy day, you don't need the artificial light. And it just gives a really nice, warm, welcoming environment in which to feel better. Because the reality is, when most of us go to the doctor, we don't feel very good.
Right.
Something's wrong. You know, we've got a broken tooth, we've got an infection, we've got the flu, we're just not feeling well.
It's part of a renaissance, if you will, here on the south side. I mean, you've got JMA right over there. You've got other development coming soon.
Yep.
The community deserves this.
Without question. Absolutely, without question, they do. And I think that was our commitment to being right here, to establishing a campus. We're moving most of the clinical services here, but we're still going to have our urgent care center over there. Quick care is going to be there. Mental health and substance abuse is still going to be over there. But that gives them an opportunity to grow and expand. And with the 15th ward project coming down the road, the resurgence is tremendous. And this is the district that has not been given that reinvestment for way too long. And it's nice to finally see it. So we knew we needed to move out, but there was no question we were staying right here.
You're staying right here. When you think about healthcare in the community and the underserved community, the need for obviously access to healthcare is so important, particularly in these, you spoke about it, these zip codes, 13205, 07, 04, right? Those are the key zip codes here. And what will it mean, you think, for this community to have this access? And just let's go through what you offer here, because this is full service under one roof.
It really is. So we're standing right now in the dental waiting room. So we have a number of dentists. We have 10 brand new operatories with state-of-the-art equipment from Henry Schein. Really fantastic stuff. Upstairs we have pediatrics. We have adult medicine. We have podiatry. and obstetrics and gynecology upstairs. So that will be one huge center. A really nice thing about once we're up and running here, we're going to put our efforts toward concluding our residency program. So we are going to train family medicine physicians in this facility.
Wow.
So that will be a family medicine clinic, and they will stay here and they will train for 3 years. There's only a few teaching health centers in New York State. We're going to be one of them. We're very excited about that.
What else would you like us to know about the soon to reopen, the soon brand new, and new name, right? We should talk about that.
Syracuse Community Health, yeah, and it's really simple, just drop the center. Because we are a community-wide campus. You know, we're in 8 schools in Syracuse School District. We have a West Side Clinic. We have an East Side Clinic, which has also gone through a significant renovation. That was about $3 million over there, and it's absolutely beautiful. That was happening at the same time this was, so we've managed 2 projects simultaneously, which is a little crazy. But we're a part of the community. We're here. We have everything you need. It doesn't take much other than to walk in, even if you experience us first in the urgent care center. And we're the only urgent care center downtown and one of the only urgent care centers in the region that offers dental services. We offer a dentist 10 hours a day, 5 days a week. And I can tell you from opening that up and wondering, okay, we're really going to get people, that by 7 a.m., our lobby is full. The waiting room is full. And we don't open until 8.
Really?
Yeah, it's crazy. The need for those types of services, often when they come in, if they come in for dental or because they're feeling sick or whatever the case may be, many don't have a primary care physician. And we're able to schedule them with one of our primary care physicians, get them hooked up, get them access. And I think that's what's great about Federally Qualified Health Center like Syracuse Community Health is it's multi-specialty. So your entry into the organization can be through dental, it can be urgent care, it can be primary care. You can come into this with just your OBGYN and then expand your access to services throughout the organization.
All right, that's Syracuse Community Health. Keith Cuttler is the Chief Operating Officer. What is the phone number for people to call?
315-476-7921.
All right, we're here at the brand new, save the date, September something.
Something.
They'll be, you'll be,
Don't hold me to a date.
and we happen to be talking to Keith on the night also that there's a great musical concert going on. So it's live and popping over here.
Oh,
today.
yeah,
It really is.
Absolutely.
All right, live here at Inspiration for the Nation. George Kilpatrick, Inspiration for the Nation, celebrating people we feel good about. James Haywood Rowling, Dr. James Haywood Rowling here. You're the commissioned artist that's going to make sure that all of the art in the brand new Syracuse Community Health will be done expertly and artistically. You also, tell me your background because you're not just doing this, right?
Sure. Well, I'll amend to say that I'm the project manager, getting all of that work into the building.
Okay.
I'm essentially doing consulting, but my day job is as Chair of Arts Education at Syracuse University, the President of the National Art Education Association. I'm on the Board of Trustees at the Houston Museum, so I'm very much embedded in the arts, investing in the arts, I have a network in the arts. And I was asked at the end of last year to be a consultant in terms of helping to bring works of art that are therapeutic and are fitting and speak to the community into this building. So this building is not just bare walls, but has this extra element which some hospitals have been experimenting with, and the leadership here, Mark Paul in specific, that definitely have the vision that that's something they wanted for this new space, and I've been trying my best to help bring that all to pass. It's a work in progress.
So you're selecting all of some of your art going to be here as well?
No, in this case, my role as the consultant was to do a call for artists, which went out locally and netted artists who are interested, who are local, and some who are from other states, who are interested in a project that I outlined for them, what this new facility was intended to do, what the vision was in terms of the artwork. To be quite honest with you, there are other aspects that are also in the works where I'm interested in working with young people, local youth, to get their artwork into spaces within the building. There's a lot that's going on behind the surface, but my role was to help spearhead bringing all that work together, helping to run a focus group of staff and personnel here to help choose the artworks that had come in the, that were submitted, portfolios that came into us, and to try to figure out what people wanted to live with every day in the spaces. These include everything from works of art in the corridors up to large murals that will help welcome in the community here in the main lobby area.
And that's a lot to think about, right? Because there's a lot of function. What do you see when you walk in the door? What do you see when you're waiting? What do you see when you walk down the hall? What do you see when you go into the doctor's offices? All of that has an intention and a purpose, and that's the challenge that you have.
That's a challenge, and it's been exciting. The leadership here has been very, very gracious and has, in spite of the fact that whenever you're building a building, I have somewhat of an architectural background too, so it helps me to sort of know the stages. These buildings, new building goes through stages.
Yeah.
And we're now finally at the place where the dust has been swept out, or it's still being swept out. The workers are out of the way, and then you can think about doing painting on walls and bringing paintings in so that they stay safe and that they don't get damaged or anything like that.
He said something about ask James about Auburn. What's Auburn?
Yeah, so one of the artists who was an original applicant in terms of the first pool of folks who said, yes, we'd like you to consider our artwork for these spaces, is a muralist who is located in Auburn. I don't know that I can give out names now because the selection process is still going on. I want to be sensitive about who's being said gets a thumbs up and who's getting a thumbs down, and so on and so forth. But one of the artists is well known for his murals in the Auburn, in Auburn, and landed well in terms of the focus groups and the leadership in terms of the images and the ideas that he's brought forth. His name will be revealed, I guess, at some point real soon. I guess the best thing I can say about that is that there's definitely expertise in terms of large-scale works and small-scale works. We have a real rich selection of artists who are going to be populating these spaces.
This is great. And again, personally, what you think about when you think about creating a welcoming space for clients and vendors and such and so forth, especially in the 13205 South Side community and 13202 for that matter. What's the aesthetic that you personally want to reflect?
That's a great question. For me, one of the things that attracted me to take on this project, because yes, there's a lot to manage. One of the things that struck me was that there's an opportunity to do something with this building that is very unusual, very groundbreaking in terms of a hospital space. Number one, the idea of the well-being of the community, not just in terms of physical well-being, but in terms of spirit and aesthetics, right? So a place that that folks feel is speaking to them and belongs to them. It's not just like a cold, antiseptic space, So part of this was the notion that we would have works of art that had a therapeutic theme to them, that had a sense of welcoming and belonging to this community, this specific Black and Brown community, and the artist would be representative of this community as well, right? So all that was going into the mix in terms of who we apply for. And here's the other thing, the cool thing about this is that because they're retaining the old building and as well as this new building, there's an opportunity to not just, the first artists that come in are not going to be the only artists that are brought in and invited in. This stuff can be rotated so that new artists can be brought in later stages in the years to come. Similar to a gallery where you have an exhibition and then it comes down and new artists come in. You see what I'm saying? So there's a lot that can happen here, and the point is that it's the ground floor of something that we think is really going to be meaningful to the community. That's been the goal.
It's great. You had a whole lot of titles, but I'm going to say project manager for.
Well, so I'll say that I am the founder of J.H. Rowling Arts Education Leadership Strategies, and it's something that is somewhat new to me, but I've been essentially consulting for years now, but just sort of like, because I have a large network and a large knowledge, and now I'm sort of like being targeted in terms of who I work with, who I help, and who, and there are other projects underway. Let's put it that way.
Right.
So I've been, so my role here is simply as the consultant under the banner of my consulting company.
And your other titles.
Yes.
National Chair of the.
The president of the National Art Education Association.
Chair of the.
Chair of Arts Education at Syracuse University, and on the board of trustees of the English Museum here at Syracuse.
See, I wanted to make sure we got all of that right. So basically, what James is saying, Dr. James Haywood Rowling, he's basically saying, I'm a bad brother. So you just know that.
I'm busy.
All right. Listen, this is a bad brother. We like talking to people who are doing some great things in our community. George Kilpatrick, inspiration for the nation.